Hello, dear friends. Welcome to Elderly Health Guide Years. If you like our content, don't forget to hit the subscribe button and help our channel continue to grow. Thank you very much for watching. Did you know that some types of fruit, yes, can actually speed up the aging process, damage the brain, and increase blood sugar worse than a can of soda? According to a 2023 study published in the Journal of Clinical Nutrition, people over the age of 65 who frequently eat certain types of high-sugar fruits have a 57% higher risk of metabolic syndrome, a dangerous condition linked to stroke, diabetes, and heart failure. The scariest thing is that these fruits are marketed as healthy or good for digestion, but they can silently harm your body every day. And if you are over 65, your metabolism is slower, your cells are more vulnerable, and your ability to tolerate sugar is significantly reduced. That means eating the wrong type of fruit can cause serious harm very quickly. But there is also good news. Some fruits are like natural medicine for the elderly. They help lower blood pressure, boost heart function, and even make the brain younger than your actual age. In this video, we will reveal 4 types of fruit that seniors should eat daily, and 4 types they should avoid at all costs. Don't miss the last one on the dangerous list. It's sweet, juicy, and loved by millions, but it can secretly exhaust you and shorten your lifespan. Before we begin, let us know in the comments below where you are watching from. And don't forget to like this video and subscribe to our channel for more videos like this. Now, without keeping you waiting any longer, let's begin. Number 4. Avocado. Yes, avocado is technically a fruit, and it deserves a special place on this list for a very good reason. Contrary to outdated nutrition advice that warned against all dietary fats, avocado is one of the most beneficial foods seniors can incorporate into their diet. What makes avocado special is its high content of monounsaturated fats, primarily oleic acid, which has been shown to significantly lower dangerous LDL cholesterol while improving good HDL cholesterol. This unique fat profile makes avocado extremely valuable for older adults managing heart issues, as better cholesterol ratios mean a lower risk of heart attack and stroke. But that's just the beginning. Many seniors don't realize that avocados contain even more potassium than bananas, about 975 milligrams per fruit, making them an excellent choice for blood pressure control, which is crucial since high blood pressure affects nearly 2/3 of people over 65. The potassium in avocados helps balance sodium levels and relax blood vessels, naturally bringing blood pressure to a healthier range without the need for supplements. Beyond heart health, avocados also provide a large dose of lutein, an antioxidant carotenoid proven to improve vision and slow the progression of age-related macular degeneration, one of the leading causes of vision loss in seniors. But perhaps the most underrated benefit of avocados is their ability to enhance nutrient absorption. Many vitamins and antioxidants found in vegetables, such as vitamins D, E, and K, are fat-soluble, meaning your body needs fat to absorb them. Eating avocado with a salad or cooked greens can increase absorption of these crucial nutrients by up to 15 times. That's a massive boost for anyone trying to get the most nutritional value from their meals without resorting to a pile of supplements. So how do you get all these benefits? Half an avocado a day is enough to reap the rewards. Spread it on whole grain toast, blend it into a smoothie, or simply eat it with a spoon and a little lemon. However you enjoy it, this fruit is truly a game changer for senior health. Number 2. Pomegranates. Pomegranates might not be the first fruit that comes to mind when thinking about daily snacks, but for older adults, this bright red fruit is like liquid gold for the heart. As we age, our arteries naturally stiffen, reducing blood flow, raising blood pressure, and forcing the heart to work harder. What makes pomegranates special is their rich supply of pinacalagins, a powerful antioxidant compound that can reduce oxidative stress in the arteries by more than 30%, according to studies published in the journal Atherosclerosis. In fact, research shows that pinacalagins have 3 times the antioxidant activity of red wine or green tea. When oxidative stress builds up, it causes the arterial walls to become inflamed and narrow, just like an old rusty pipe. But pinacalagins help clean that out, allowing blood to flow more freely and smoothly. In addition, pomegranate juice has been shown to lower systolic blood pressure by 5 to 21% in people with hypertension, a very significant number for older adults trying to control blood pressure without increasing their medication. But that's not all. Pomegranates also support memory and brain function. In a UCLA study, older adults who drank pomegranate juice daily showed significant improvements on verbal memory tests compared to those who didn't. This is crucial since memory loss is one of the biggest concerns associated with aging. For those worried about dental issues, pomegranate juice provides many of the same benefits without the need to chew. Even concentrated antioxidant supplements have shown promising results, though eating the whole fruit still offers extra fiber and micronutrients. Here's the thing, you don't need to drink a full glass every day. Just eating half a cup of pomegranate seeds or adding a splash of juice to your morning smoothie can offer big benefits. And unlike many other sugary fruits, pomegranates have a low glycemic index, which means they won't cause blood sugar spikes. That makes them ideal for seniors with prediabetes or type 2 diabetes. Just make sure you're choosing 100% pure pomegranate juice with no added sugar. And if you're taking blood thinners, always check with your doctor first, as pomegranates may have mild interactions with some medications. Overall, though, this fruit isn't just good for you. It can actually help extend healthy lifespan by keeping your heart younger for longer. Number 3. Apples. Apples are extremely rich in fiber, especially a type called pectin, which helps nourish the beneficial bacteria in the gut. A healthy gut microbiome leads to better digestion, a stronger immune system, and more efficient nutrient absorption. 3 things that become increasingly important as we age. But what makes apples even more impressive is their impact on cholesterol and heart health. Pectin binds to cholesterol in the digestive tract and helps remove it from the body, thereby reducing LDL cholesterol levels over time. Apples also contain flavonoids like quercetin that help reduce inflammation and support cardiovascular function. And don't forget the role of apples in regulating blood sugar. Despite their sweet taste, apples have a relatively low glycemic load, and their fiber content helps slow the absorption of sugar into the bloodstream, preventing sugar spikes and crashes. This is especially beneficial for seniors with insulin resistance or type 2 diabetes. Apples are also very filling thanks to their high fiber and water content, making them an excellent choice for controlling cravings. And here's something not many people know. Chewing apples stimulates saliva production, which helps reduce the risk of tooth decay and gum disease, problems that become more common with age. Red, green, or yellow, apples are among the most accessible and versatile fruits. Adding just 1 apple to your daily diet can support nearly every major system in your body. Number 1. Berries. Blueberries, blackberries, and raspberries. Topping the list of the best fruits for older adults are berries, specifically blueberries, blackberries, and raspberries, 3 types of fruit that deliver the most age-friendly benefits of any food. What makes berries particularly valuable for seniors is their direct impact on cognitive function and brain health. These little gems are packed with anthocyanins, natural plant compounds that not only give blueberries their vibrant color, but also act as powerful antioxidants. When you eat berries, these compounds go to work reducing inflammation in the brain and improving communication between brain cells. In fact, a groundbreaking study published in the Annals of Neurology found that older adults who consumed just 2 servings of blueberries per week experienced a significant slowdown in cognitive aging, up to 2.5 years. This means they maintained the brain function of someone 2.5 years younger. This brain protective effect seems to be tied to the unique ability of berries to cross the blood-brain barrier and directly neutralize oxidative damage in brain tissue. But the benefits don't stop at memory. Blueberries also improve balance and motor coordination, which is crucial for preventing falls, one of the leading causes of injury among older adults. The cardiovascular benefits of regular berry consumption are equally impressive, with multiple studies showing significant reductions in blood pressure, improved arterial elasticity, and decreased inflammation markers in seniors who include berries in their daily diet. These effects translate into a noticeable reduction in heart disease risk, a critical factor since heart disease remains the leading cause of death among seniors. In addition to these major benefits, berries offer exceptional blood sugar control thanks to their fiber and bioactive compounds that help stabilize glucose levels after meals, preventing spikes that can worsen diabetes or prediabetes, both common conditions in older adults. The fiber content in berries, about 8 grams per cup, also supports digestive health and promotes regular bowel movements without irritating a sensitive gut. Just 1 cup a day, whether added to oatmeal, yogurt, or a smoothie, can make a noticeable difference in energy, focus, and even mood. Just be sure to choose fresh or frozen berries. Avoid dried ones, as they often contain high levels of added sugar that cancel out many of the health benefits. Now that we've discovered the 4 fruits seniors should definitely eat every day, let's take a look at 4 fruits they should absolutely avoid, starting with one that might be hiding right in your kitchen. Number 4. Grapes. At first glance, grapes seem like an innocent, even healthy snack. They're small, sweet, and refreshing, often promoted as a good source of antioxidants, particularly in red or black varieties. But for older adults, grapes can be surprisingly misleading. One of the biggest concerns? Their extremely high sugar content combined with very little fiber. Grapes contain simple sugars, mainly glucose and fructose, and because they're so easy to eat by the handful, it's incredibly easy to consume far more sugar than you realize. In fact, just 1 cup of grapes can contain up to 23 grams of sugar. That's about the same as a small candy bar. For older adults struggling with blood sugar control, this can be disastrous. The lack of fiber means that the sugar is rapidly absorbed into the bloodstream, causing blood sugar and insulin levels to spike. And these fluctuations aren't just temporary. They're linked to weight gain, inflammation, and an increased risk of developing type 2 diabetes. Another issue is that grapes are among the most pesticide-contaminated fruits, if not bought organic. For older adults with weaker immune systems or sensitive digestive tracts, these residual toxins can pose a serious risk. Even the grape skins, thin and easy to chew, don't provide the nutritional value you'd get from heartier peels like those on apples or pears. So the bottom line, grapes may look innocent, but they're really a blood sugar disaster in disguise, especially dangerous for seniors trying to maintain stable energy, a healthy weight, and balanced metabolic health. Number 3. Dried fruit. Dried fruit, especially the kind commercially processed with preservatives like sulfites, is one of the most deceptively problematic fruit options for older adults, even though it seems healthy and convenient on the surface. The first and most obvious concern is the extremely concentrated sugar content. When fruit is dehydrated, what's left is mostly fructose in a compact form. For example, a small handful of dried apricots can contain as much sugar as eating several fresh ones, making it easy to consume a large dose of natural sugar without the water and fiber that typically signal fullness to the body. This concentrated sugar is particularly dangerous for older adults managing diabetes or insulin resistance, as even small amounts can trigger sharp blood sugar spikes. Over time, this can lead to the development of type 2 diabetes, or make managing existing conditions significantly more difficult. But the damage doesn't stop there. These blood sugar spikes also fuel systemic inflammation, which can worsen arthritic pain, accelerate cognitive decline, and weaken immune function, all serious concerns for aging bodies. To make matters worse, most mass-produced dried fruit contains sulfites, chemical preservatives used to maintain color and extend shelf life. Sulfites can trigger severe asthma-like reactions in sensitive individuals, and older adults are at greater risk due to age-related declines in respiratory function, as well as higher rates of asthma and COPD in this population. While about 1 in 100 people have sulfite sensitivity, that number is believed to be much higher in seniors with pre-existing respiratory issues. The combination of inflammatory sugar load and chemical additives makes dried fruit a particularly poor choice for seniors dealing with inflammatory conditions like arthritis, which affects nearly half of all adults over 65. Number 2. Unripe bananas. While ripe bananas with brown spots can be a nutritious choice for many older adults, unripe or green bananas come with a host of health concerns that make them one of the worst fruits for seniors. The primary issue with unripe bananas is their high content of resistant starch, a type of starch that doesn't break down in the small intestine like the simple sugars found in ripe bananas. In older adults, how often experience age-related changes in digestion, such as reduced enzyme production and slower gut motility. This resistant starch can cause significant digestive discomfort, including bloating, gas, and abdominal pain. These effects are even more pronounced in seniors with irritable bowel syndrome, IBS, or inflammatory bowel disease, both of which become more common with age. The digestive difficulties caused by unripe bananas aren't just uncomfortable. They can also impair the absorption of nutrients from other foods eaten during the same meal. This is especially concerning for older adults who may already struggle with nutrient deficiencies due to factors like medication interactions, reduced appetite, or declining absorption efficiency. Additionally, the astringent compounds in unripe bananas, the ones responsible for that dry, chalky mouthfeel, can irritate the lining of the gut in sensitive individuals, potentially triggering inflammatory responses in the bowels. Nutritionally speaking, unripe bananas also contain far fewer antioxidants compared to their fully ripe counterparts. These health-promoting compounds increase significantly as the banana ripens. For seniors seeking the anti-inflammatory benefits of fruit, unripe bananas simply don't deliver, making them a decidedly inferior choice. Number 1. Grapefruit topping. The list of fruits older adults should avoid is a surprising culprit: grapefruit. Though often marketed as a healthy, weight-friendly choice, this citrus fruit hides a serious, even life-threatening risk for seniors who take prescription medications. The danger lies in grapefruit's high content of compounds called furanocoumarins, which interfere with an important enzyme in the small intestine called CYP3A4. This enzyme is crucial for the breakdown of about 85 different medications. When grapefruit blocks this enzyme, medications can build up to dangerous levels in the bloodstream, as if you had taken multiple doses, even if you stuck to the prescribed amount. This greatly increases the risk of side effects, some of which can be severe or even fatal, depending on the drug. The list of affected drugs is long, including many commonly prescribed to older adults, such as statins for lowering cholesterol, atorvastatin, lovastatin, simvastatin, calcium channel blockers for blood pressure, felodipine, anti-anxiety medications, buspirone, antiarrhythmic drugs, amiodarone, even antihistamines and immunosuppressants. For instance, drinking grapefruit juice while taking Lipitor, atorvastatin, can raise blood levels of the drug by over 400%, drastically increasing the risk of serious side effects like muscle breakdown, rhabdomyolysis, and kidney failure. What makes grapefruit especially dangerous is that it doesn't take much to trigger a reaction. Even half a fruit or a small glass of juice can be enough. And worse yet, the effect of grapefruit can last for up to 72 hours, meaning just taking meds at a different time doesn't solve the problem. Because of these serious interactions, and the wide range of common, life-saving meds they affect, grapefruit deserves the number 1 spot on the list of fruits that older adults should avoid or consume only under medical supervision. Here's the final part to wrap it all up. If you take any prescription medications, it's absolutely crucial to check with your doctor or pharmacist to see whether grapefruit or grapefruit juice is safe for you. Never assume it's harmless. The risk of dangerous drug interactions is simply too high. Grapefruit may look like an innocent fruit, but it carries a stealthy and serious health threat for many older adults. And now, you've got the complete braid of the fruits older adults should eat and those they should steer clear of. Then good guys like avocados, apples, pomegranates, and berries can truly help you age better, think sharper, and feel stronger. But the bad ones, like grapefruit, dried fruits, underripe bananas, and even seemingly harmless grapes, can quietly drain your energy, spike your blood sugar, and ramp up inflammation, setting the stage for long-term harm. And the scariest part? Most of the time, it all happens silently. Most people have no idea that a small handful of grapes or a slightly green banana could trigger a whole cascade of health issues until it's too late. So make smart choices, eat mindfully, and if you can, pair your fruit with healthy fats or protein to slow digestion and keep blood sugar stable. Now we want to hear from you. Have you been eating one of these bad fruits without realizing the risk? Which one surprised you the most? Have you ever had a strange or unexpected reaction after eating a fruit? Drop your thoughts and stories in the comments below. We're excited to hear from you. Thanks for watching. Don't forget to like, comment, and subscribe. Your support truly keeps us going and helps more people stay informed and empowered. Take care, stay safe, and eat smart. See you in the next one.